Welcome to this episode of Transforming Tomorrow. My name is Eric Carey, Chief Information Officer for Valley Health System. Today I'm pleased to talk to you about the completely redesigned nurse stations.
What I really like about the way we've done things is that our staff are designing the way that we're going to operate in our new campus. Our staff have been involved from the very beginning to help design that process, and they'll be very important in implementing it as well.
And now let's hear from the subject matter experts to provide more details on the completely redesigned nurse stations.
I'm excited to be here today to talk about it because I know that when we designed the nursing station that we had frontline staff members involved in every element of the design. So I truly believe that it's going to meet all of the needs for all the caregivers on the unit.
So a nurse station is an area within each nursing unit that is kind of like the command center of the unit. The charge nurse or CSS is there, and it's a place where staff members at times may come to connect with different members of the team.
It's big, it's open, it'll allow all the members of the care team to actually sit side by side if necessary, which will help improve communication. It also gives them a nice view of the unit. There's a couple features that we have there which we don't have now. The nurse communication board, which would allow you to actually look at all the patients on the unit, to look at their bed status, the nurse assigned to that patient, contact information, if they were on telemetry, if they're on a one-to-one. So it gives you a nice high-level view of the unit. I'm excited that every nursing station will also have a team room, which would allow all the members of the interdisciplinary team to get together, nurses, PCAs, physicians, to better plan the care of our patients. The design of the new unit also gives our nurses and other care providers great flexibility when documenting, which I think is great. This will allow the nurses to document either in the patient room, which is preferred because it will allow them to have greater face time with the patients. But they can also move to the hallway or even the nursing station when necessary.
There is a computer, and there are windows that allow for accessibility into the patient rooms. The windows will have an inline blind to allow for patient privacy. However, the staff can sit, if need be, outside of that patient room and do their documentation and not always need to go back to the nurse station.
The new nursing stations were designed to minimize barriers to patient interaction. By having an open concept with the new nursing stations, we feel we've created an environment that will stimulate more interaction between family members, patients, and care providers.
One of the benefits in the configuration of the unit and where the nurse stations are located is that they will be standardized. So those nurse stations will be in the same location from unit to unit.
Because of the size of the nursing units, incorporating two separate nursing stations was really important. This will allow staff members to have greater exposure to either side of the unit. Also, it will allow nurses not to have to walk from one side of the unit to the other, as well as giving family members and patients additional access to the staff. I'm really excited about the collaborative effort that it took to create these nursing stations, and I really believe that we will truly be able to better meet the needs of our patients and families.
I'm Kathy.
I'm Charles, and together we're transforming tomorrow.